Dr. Michelle Fiscus is with us, pediatrician, talking about immunizations. Several calls. Let's just go right back to the phones. Let's go to Steve. Hello, Steve. Steve, are you there?
I'm here.
Yes, sir. Okay, go right ahead.
Well, I have to disagree with this lady, and I'll tell you why. First of all, there are doctors that do not agree with her, and I would encourage you to have someone on the show that has the opposite opinion, because the big push is for, not having any exemptions for vaccines. I wanted to share a quick story, and that is that I grew up, my mother was religious with regard to doctors. I went to the doctor and got every vaccine in the book. I stayed sick my whole childhood, pretty much. When it became time for me to decide on vaccines for my kids, I went to the physician's desk reference, looked up the side effects that the drug company said would happen, and when I came to pertussis, and one of the side effects was sudden infant death, I decided I wasn't vaccinating my kids. My kids grew up healthy. The worst thing they had was a cold or maybe a light flu, and they grew up healthy as a rail. Now, as an adult, they did get, my son got whooping cough, my daughter got whooping cough, and she got, she got the chicken pox as adults. And it was not life-threatening, and it was not that big a deal. It was more of a nuisance, okay?
Okay.
Also, if you can't find a doctor that will come on, I will come on the show. I've heard all the arguments. I will come on the show and debate this lady. But I'm sorry, when we didn't vaccinate, one of the big problems here is that we had no need for a pediatrician. We didn't take our kids to a pediatrician because they weren't sick, except for we followed the state law and went for an initial analysis of the blood to be sure they didn't have PKU and some of those different things. But,
all right, well, Steve, okay, I appreciate that. Let's see what she has to say here. All right, so you hear what he's saying.
Sure.
What do you think?
So I will obviously disagree. It's interesting that his unvaccinated children went on to develop vaccine-preventable diseases. You're sharing a story of a couple of kids who both ended up with vaccine-preventable diseases. I also have a couple of kids who are fully vaccinated, grew up completely healthy, and haven't contracted vaccine-preventable diseases. So I think this is where we get into trouble with anecdotes or telling stories. So when your view is of your two children, then you're losing the big picture of what happens to other people. And with respect to SIDS being something that's reported with the whooping cough vaccine, whooping cough is a cause of SIDS. So you are much more likely to develop sudden infant death from developing whooping cough than you are from getting a vaccination. And actually all of the studies that we have show that vaccines are actually preventive against early and unexpected infant death.
He says there are doctors that say this, that agree with him. Mm-hmm. What about that?
So the word doctor gets thrown around a lot. So there are medical doctors who go to medical school and go to an accredited residency and take boards and become board certified. There are other types of people who also get to call themselves doctor in this state. There are naturopaths, there are chiropractors, and so they do not have necessarily the same kind of rigor around the importance of vaccines and understanding the immunogenicity and the prevention that's needed from vaccines. So it's a different, oftentimes a different type of medical professional. We have decades and volumes of science to show that vaccines are really important and that they save a lot of lives.
Let's go to Wayne. Hello, Wayne.
Yes, good evening.
Go right ahead.
I'll ask you a real quick. I got a quick question. I'm just curious. I hope she can answer.
Okay.
Is there any way that we can catch a virus from one of our pets? And can one of our pets catch a virus from us?
Interesting.
That's a really good question. So, Wayne, I'm not a veterinarian. There are some illnesses that we can catch from our pets. I'm not aware of any common viruses that we catch from a domesticated dog or a cat. Obviously, we can catch things like rabies, which is a virus from wild animals, and we do have raccoon rabies and skunk rabies and bat rabies in Tennessee. But I'm not aware of a virus that a human would catch from a domesticated
like bird
pet.
flu. What's the deal with bird flu?
Well, so that's and so when I'm thinking about pets, I'm thinking dogs and cats. But there are diseases that can be transmitted from birds, or where birds are a vector, and so a mosquito bites the bird, and then the mosquito bites a person. Same with things like ticks that might feed off of a mouse that's infected with a virus and then bite a human. But as far as domesticated animals like our cats and dogs in our homes, outside of rabies, I'm not aware. But you should check with your vet.
Check with your vet. All right, very good. Take a break. Be back right after this.